have been a chairperson of the Health Committee at least for 10 years at this National Assembly. And I just, as a matter of fact, just relinquished the position not too long ago on account of having an extremely very busy schedule. So I'm alive to the fact that I have networked and participated in so many forums and platforms on health. And one of them is actually the NEAPACOH, which stands for Network of African Parliamentary Committees of Health in Africa. So this is an alliance or a network, as the name says, of health committees, like our health committee here at this parliament, together with the other health committees in various parliaments here on the African continent, who decided somewhere around 2005 and so on to actually come together and begin to compare notes on the kind of work that they do in their parliaments. As you know, health is universal. Basically, what afflicts us here in Zambia will not spare our colleagues in the neighboring countries or any other if we do not work in a collaborative manner and fashion. So it was thought by colleagues who were there at that time in the health committees that we needed a platform where we could exchange ideas, we could come together and look at our national health priorities, we could come together and look at the common themes in health on the African continent, we could come together and learn how to engage in legislative scrutiny of our executives, how we could basically be doing the same thing, okay, in the various parliaments, how we could track international obligations and commitments, starting from our at country level, we go to regional levels, and then we go to African level, and the global level, such as the Sustainable Development Goals and so on. So basically, NEAPACOH is a platform of committees of health who come together, especially once a year, as it's going to happen here in Zambia next week, to actually come and look at the common things on the health agenda so that all of us are moving in one direction. It is also a platform where we collaborate together. It's very important, international cooperation, basically in good governance and so on. It is one way of what is known as parliamentary diplomacy, okay? Reaching out to your neighbors, reaching out to your friends who are doing the same thing as you are doing, putting the health of Africa at the center, because all of us as politicians are representatives of the people. We've committed to improving the lot of our people. And in this particular case, it's on the health front. Because we are doing the same thing, it is therefore important that we meet and compare notes.
Okay, so Dr. Kalila, you did mention that you've actually attended most of these forums, and the goal has specifically been improving the health coverage across the NEAPACOH countries. Would you share with us some of the achievements from these discussions that you've been having in the previous forums?
Yeah, so basically, health is a human right. So each and every one of us are entitled to quality health care, and all our countries subscribe to the United Nations, the Universal Declaration of Human Rights, and we are all party to the Sustainable Development Goals, number 3 of which talks about well-being of our people and ensuring that we deliver quality health. So because of this, as I've already alluded to, NEAPACOH does organize on an annual basis these meetings and forums. And at each meeting and forum, there is a theme. In other words, there's a particular subject that we look at. So in the past, we have looked at various aspects in the health sector. Mainly, it has been health spending or domestic financing. How can we ensure that our governments are spending more money on health of our citizens? And in particular, how can our governments realize the Abuja Declaration, where our heads of state, 2001, met in Abuja, Nigeria, and decided that each one of our countries must at least spend 15% of their national budgets on health. But unfortunately, It's only about 2 or 3 countries which meet this declaration. So we meet, and we have discussed this before, to try and understand why we are not meeting this important commitment. And as member countries and member states, we make commitments that when we go back to our parliaments, we will begin to speak on the floor of the House, reminding our health ministers, our governments, and executive crews to increase health spending. As you can see here in Zambia, I think we've done fairly well. We've been progressively increasing. I think we are somewhere around 12% or so. Of course, we are not yet there, but I think we are in the right direction. In fact, some other there are also arguments to suggest that, in fact, we could be meeting the Abuja Declaration when you factor in health spending that happens outside the Ministry of Health, such as the churches, such as the defense forces, and so on and so forth. So domestic health financing has been a very important subject, and basically our members in the Health Committee have benefited greatly around this issue. We have also looked at sexual and reproductive health and rights, basically ensuring that our citizens have got access to quality sexual and reproductive health rights. We have looked at HIV and AIDS, especially at the beginning of NEAPACOH when it was formed. You know, that's the time when many of the countries in the world were actually afflicted by the AIDS pandemic at the time. So we looked extensively at all these subjects. We have looked at universal health coverage in the last 10 years. Universal health coverage simply means that we have to provide quality access to health care to all our citizens all the time without suffering financial loss. And this has led to the setting up of health insurances in many of our African countries. These are subjects that we have been discussing. You know, we have NEMA now. So Zambia at one of these meetings made a commitment that they were going to push for the enactment of a health insurance scheme. And somewhere around 2017, 18, 19, that was mainly the discussions in these NEAPACOH forums, and we're happy to see that now we have NEMA, which was very much supported by the Health Committee. So we have learned quite a lot from these meetings, and we hope that this conference that is coming forward, incidentally, the hosting of this conference was born from the Tanzanian conference, which I attended then as chair of the Health Committee, and many members felt that Zambia, as an active member of NEAPACOH, in fact, Zambia is a founding member of NEAPACOH. At the time, it was called SEAPACOH, and felt that it was high time we hosted NEAPACOH in Lusaka. One of the early meetings was one of the very early meetings was also held here in Zambia. I think it was at Kafiwe Gorge in the 2000s or something like that. So, and everybody just said, no, it's the time for Zambia now. You are such an important country in the region. You are very peaceful. You've always participated. You're very active. We're all looking forward to coming to Lusaka. And so we came back and, of course, engaged parliamentary management here. And I'm very happy to finally see that this conference is coming to Zambia. It is a very important conference, Taza. You are talking about,
yes, indeed, Dr.
you are
Kalila.
talking about, our expectation was roughly around 33 countries to come and attend this. Of course, registration is ongoing. I don't have the exact figures, how many have confirmed coming, but we'll be happy if we could get at least even half of those who are coming to attend this very important conference. So our colleagues from the region of Africa will be in Lusaka, parliamentarians, chairs of health committees, discussing with us, with other colleagues, sharing notes, tracking international commitments, discussing generally the very issues that affect the health of our people. We have discussed so many things, you know, epidemic preparedness, we've discussed climate change, we've discussed the health of young people, adolescent health, which is very important because they are the future of our countries. And it's important that as nations, we invest significantly into the health of our people. After all, imitikula empang. So that, in fact, the health of our young people is always one of our recurring themes at these conferences. Family planning, okay? How can we reduce maternal deaths on the African continent, gender-based violence, the plight of the health of women, okay? All these things we continue to discuss.
Dr. Kalila, you did also mention about the domestic health financing, and I'm very much aware that the Planning and Budgeting Committee will be attending this conference. How does this make you feel, and what significance will the participation of the Planning and Budgeting Committee bring to the forum?
Yeah, so this is a meeting of parliamentarians, and as you know, the committee system is the engine of parliamentary practice, because that's the those are the meetings at which members of parliament scrutinize very closely government administration, you know, the budget or the various policies, particularly for us in the health sector. And one of the gaps that we have seen over the years is the dwindling resources to the health sector. And so we took it up many years ago to begin to push our governments to increase health spending to meet the Abuja Declaration, as I have mentioned to you. But we realize that it is very difficult to achieve this if we don't involve the actual ministry that is involved in appropriating, or rather apportioning these monies to the health sector, which is the Ministry of Finance, and the people who provide this kind of oversight are our colleagues, the Budget and Planning Committee. So it was very, very important. We found it useful that we must move together, okay? Not only us from the health angle, but also our friends and our colleagues in the Budget Committee. In fact, we have had joint meetings together on various platforms, including NEAPACOH itself. Even in the last meeting that we went to Tanzania, we actually went with the chair of the Budgeting and Planning Committee, Honorable Chatila. So it's the same thing. We expect this will happen. Even our colleagues, as they come, we expect on their delegations that it will be a mix, not only those from the health sector. So health, to achieve health, is a collaborative effort to various players. It starts with yourself, then it involves people associated only with people in white coats and white uniforms and so on, but there are other players who need to do that. At the heart of it all, you need money. You can do nothing without resources, without money especially.
Okay, and to our viewers and listeners out there, thank you for tuning into Parliament Television and Radio. This is the NEAPACOH Forum Update. And I must make mention, I do have Dr. Christopher Kalila as one of the guests here in studio, and we've been joined by Honorable Levan Chiwombwe, who is a Bahati Member of Parliament. Good morning, Honorable, and welcome to the program.
Good morning, thank you, and good morning to our viewers.
Okay, it's good to have you, and it's good to know that you've made it for the program. I know you're coming from the Committee on Health, Honorable. What does this NEAPACOH Forum mean to the Committee on Health?
Thank you so much. First of all, good morning to Dr. Kalila.
Yeah, good morning, Leader.
And it's good that you are here. This is our guru in the committee. We're so excited as members of the Health Committee that the NEAPACOH is coming to Zambia. Actually, like Dr. Kalila mentioned, we attended the last NEAPACOH meeting in Ramada, Dar es Salaam. I think it was around March 6th to 7th, and so many commitments were made. And, you know, we agreed with all the stakeholders that the next NEAPACOH meeting should be held in Zambia. And we're so excited as, you know, a committee, and we're looking forward to this conference.
Okay. Yeah. Dr. Kalila,
yeah.
Being former chairperson of the Committee on Health, what specific roles did your committee play in shaping Zambia's health policies and laws?
Well, the Health Committee here at the National Assembly has played a very critical role in shaping health policy. You know, as parliamentarians, we operate from a legislative angle. We make the laws, okay? Yeah, we represent our people. We provide oversight to the Ministry of Health. And I can tell you over the years that most of the policies that you see in the Ministry of Health, particularly legislation, has passed through this committee. So our approach has been one of a collaborative effort. Our approach has been one of complementing the works of our colleagues in the Ministry of Health, We normally have discussions with them, even outside the committee, when they are about to introduce legislation or anything else. And similarly, they always try to reach out to us. Why do we do that? It's very important that we move together, and so that when a bill comes finally on the floor of the House, the committee is already aware of the objectives and the intentions behind that bill, and then we will give them our opinions and advice. We interrogate together so that finally it passes in a very easy manner. So several legislation have passed through here, and we have supported them. And just as a matter of example, I mentioned to you the National Health Insurance Management Authority is one of the laws that we worked together to pass through here. The Zambia National the setting up of the Zambia National Public Health Institute, very important in public health security, epidemic preparedness. As you know, this country, we have perennially experienced cholera outbreaks. We had a very big global pandemic, basically COVID time, and so on. So we needed some sort of legislation and an institution that can be at the forefront of trying to protect citizens against future epidemics and pandemics by advising government, by actually engaging in disease surveillance, trying to figure out exactly the feelers on what's happening and so on. So this committee actually supported the setting up of the Zambia National Public Health Institute. I can go on and on and on. We actually work together with the Minister of Health in various other areas. I mean, the health professions.
And Dr. Kalila, sorry to cut you short. How can NEAPACOH member countries learn from these experiences that you've talked about? So
that's precisely the reason why NEAPACOH was created, to ensure that we sit together, learn from one another, okay, share the experiences, try to look at the best practices in various countries. We are not saying that we are the only ones who've done this and that better than others, but there are areas where we've done better. There are also areas where our colleagues have done better. And so we look to each other, and there's a time when we ask countries to present, and then we try to tease out from the presentations what we consider are the best practices, and we try to take them home. But we also make commitments. Each member country makes a commitment that when we go back home, we are going to push for this. For example, in domestic resource mobilization, every country made a commitment, and we also made a commitment. Yes, we need to have insurance in this country. We're going to push for the insurance scheme to be enacted, and we are going to push for innovative ways to finance health outside the budget. We made a commitment. We're going to be talking to our Minister of Finance, Minister of Health, to increase health spending. So when we came back, we started asking those questions on the floor of the House. And so similarly, our colleagues also do that when they go back. In fact, at this meeting, where we will be meeting next week, there will be a session specifically for every country to review the commitments that they made in Tanzania, to tick which ones have been actualized, and to highlight the ones that have not been actualized, and to give a roadmap, or indeed to share what are the reasons why that has happened. There are also other emerging, very important health themes that we normally tackle at every NEAPACOH meeting. And these are things like antimicrobial resistance, which is the failure of our antibiotics, which we have used for so many years, and which were used traditionally to treat infection and so on. And we have seen now that most of them are not working. And that is very dangerous, because the practitioners will know exactly what's wrong with you and what you need, and they will prescribe, but the medicine will not work. Okay. And you can imagine what would happen. So we are going to compare notes around there to see what can be done about it, how people can use these medicines very judiciously to ensure that they don't develop resistance. There are various issues. We've been looking at tuberculosis. Over time, we've been looking at COVID, we've been looking at epidemic preparedness, and so on and so forth. But we never lose one sight. All these things, to deliver health, is very complicated and requires a lot of money. Okay, so let me just now bring in Honorable Chibombwe. Honorable Chibombwe, you are equally part of the Committee on Health. We would like to know, what is your specific role as a member of the Committee on Health, and how is this going to reflect during the NEAPACOH forum, the roles that you have on the Committee on Health?
Thank you so much once again. My role extends, from the mandate of the committee in providing oversight on policies, legislation, and legal interventions on health matters. These matters may take or may come in form of a bill, performance audit report, or any other ad hoc matter presented to the committee for scrutiny. Right now, I will be scrutinizing the tobacco control bill, and I'm hoping that during this NEAPACOH meeting, tobacco control can come in. Dr. Kalila, there's so much tobacco abuse in the country, where you see young boys and girls, school-going children, inhaling the so-called electronic cigarettes. There's so much use of a substance called shisha in our restaurants and nightclubs. So it's one of the bills that the committee will be scrutinizing, I think, after next week. And I'm so hopeful that this tobacco control can come up during the NEAPACOH meeting. Like Doc alluded to earlier, we made commitments to ending TB in Africa, I think at the last NEAPACOH. And what is causing TB in Zambia, tobacco usage is one of them. So we are hoping that these matters should come up during the NEAPACOH meeting.
And Honorable Chibombo, before I move from you, how does Zambia's participation in this forum, how do you think this will enhance parliamentary oversight and accountability in the health sector? I know you did mention some of the roles that you play on the Committee on Health.
Yeah, this will, of course, strengthen capacity amongst members. We need to have a broader understanding of healthy matters on matters that are affecting our people, matters that are affecting our people on the continent. We are now facing issues of SRHR. The disease burden in Zambia is so high. Dr. Kalila, just a few weeks ago, we had some meetings on cancer, and we were told that Zambia has got the highest burden of cancer in Africa. Cervical cancer is killing most of our women. So these are matters that members and delegates at the NEAPACOH should discuss. So all in all, the NEAPACOH coming to Zambia, I think, will enhance parliamentary oversight, and it will strengthen, it will make members, debate well on these issues.
Okay.
Yeah.
And Dr. Kalila, what benefits do you think Zambia will gain from hosting the NEAPACOH forum?
Yeah. So before I actually answer that question, I just want to add on to what my colleague Honorable Chibombo was talking about. So the role of a parliamentarian is very well known and is prescribed in our various constitutions, and it's the same thing, is to provide oversight to our executives, to actually approve budgets, okay, to be representatives of the people, to approve international agreements and so on, including tracking some of these agreements. So it's the same whether you're an MP in Zimbabwe or you're an MP here in Zambia. Basically, from a legislative angle, those are your roles. And in whatever we do as parliamentarians, whatever task we are given, we must always look at it in that angle. Okay? How do we provide parliamentary scrutiny to our executive? How do we provide oversight? What are some of the tenets that are involved? How does a committee system work to ensure that you check government administration? Now, members come and go, they come from various backgrounds, so it's very necessary that you build their capacity in these tenets. And NEAPACOH provides a forum at which we actually build capacity in members of parliament among ourselves on how to engage in legislative oversight, how to approve budgets, how to analyze budgets related specifically to the health sector, okay, how to raise the right questions, how to look at the national priorities in the health sector. Okay, each country has its own health priorities, but there are those that are common. For example, epidemic preparedness. COVID afflicted everybody else, so it's expected that all of us must be able to do the same things and to teach each other on what to do, to be prepared, how to cooperate with each other, and what kind of laws we want to put in place that are common to ensure that we have a safe environment. You know, health is a security issue, okay? Sometimes, like, for example, in epidemics, you deal with an invisible biological agent which you can't see, and it can decimate millions, as we saw in the time of COVID, okay, which people don't look at. So we need to spend so much money for that. So it's very important. But it comes to benefits. First, we must learn as a country that hosting conferences is extremely very beneficial. And there are many countries, examples on the African continent, which are always hosting these conferences, providing platforms for people to come together. I mean, every time people are either going to Rwanda, or they are going to Ghana, or they're going to Kenya, it is not an accident. It's a deliberate policy to ensure that you host these conferences, because there are spin-off benefits. You can imagine all these people that are going to be here in Lusaka, they will need accommodation. Our hotels will obviously benefit. They will need meals. Our hotels will benefit, or restaurants, transportation, okay, they will benefit. And each one of those delegates will spend out of pocket for something. They will visit East Park, Manda Hill, arcades, and so on. So all that will be spin-off to the local economy and finally to the country's economy. And if that is done repeatedly, then you can really reap some benefits. But also from the health side, definitely Zambia stands to benefit from the lessons that we pick up from best practices from our colleagues in various regions. Those who have done it well will look at their indicators compared to our own indicators in the health sector, and those that we feel, oh, how are they managing to achieve this? How have they reduced maternal mortality rates better than us? What did they do right? So we can learn from them. And then, because we are parliamentary, remember, we are not executive. Our role is to support our health ministers and to remind them and to tell them, look, you should do it this way. Look at this country. They were able to do this and they achieved this. So then we'll be better members of parliament. Like my colleague here, who have been with him for so many years in the health sector, is an engineer, electrical engineer. But now he's able to articulate matters in the health sector. You see, and so many others, we believe, will be able to do that.
Okay, so let me just also bring in Honorable Chibomwe. Yeah. From your end, what benefits do you think Zambia will gain?
So from my end, Zambia will gain quite a number of things. You know, there will be, information sharing, which is very crucial in the health system. We need to know what our colleagues in the region, we need to know what our colleagues in the 33 member states are doing. So I think in terms to information sharing, Zambia benefits. There's also an aspect of technology sharing, which is also quite critical. We need to know if there are machines that we do not have here that our colleagues are doing. There's also what we're trying to promote. I think when I just first joined this committee, we undertook a trip to East Africa where we were benchmarking on the local pharmaceutical industry. And we did a report, and it has yielded some results. I think we presented it on the floor of the House some years back. So we have to learn on how this pharmaceutical industry is growing in other parts of the continent. Doc earlier alluded to the issue of COVID-19. These pandemics that do break out. We've got the cholera, the Ebola. Africa is still grappling with cases of Ebola, especially I think in the DRC. So we need to sit and discuss and see how we can come up with homegrown solutions. We need to start producing vaccinations, Dr. Kalila. We've been hit with some of these diseases for a long time, since the 60s. So I think those are some of the lessons that we can learn as a country on how our colleagues are, how they are operating the health system. So I think we're poised to learn quite a number of things as a country, even as the members of the committee.
Okay, thank you very much. And just now we will take a break. This is the NEAPACOH Forum update. We come in live from Parliament buildings. Zambia will be hosting this forum from 25th to the 27th of February 2026. Do join us on the other side.
President Hakainde Hichilema on Friday, 20th February 2026, addressed the nation on the progress made on the application of national values and principles. The address will be broadcast live on Parliament's television on DSTV channel 272, GoTV channel 28, Topstar channel 5, Parliament Radio, the National Assembly of Zambia Facebook page, and our YouTube channel. Note that access to the seating of the House will be strictly by invitation. Make a